Hi, my name is Brie O'Brien, and this is Lisa Solovey, physical therapist and clinic director at Rehab Connections in the West Deptford location. So Lisa, you're here to tell us about tension headaches. Can you explain to us what exactly are tension headaches?
Sure. A tension headache is pain or discomfort in the neck, the head, or the scalp region that's caused by tightness of musculature in those areas. And it's the most common type of headache.
Okay. So how can I tell that I'm having a tension headache rather than your normal migraine or even a possible herniated disc in my neck or sinus headache?
Sure. Well, a sinus headache, I'll start with that, is usually associated with sinus infections. So you'll have a fever-like symptoms, cold, like coughing, runny nose, those kind of things, pressure in the head that's associated with the headache and the infection, of course. A migraine is more severe in nature. It's typically located on just one side of the head, whereas opposed to tension headache is usually bilaterally on both sides. And a migraine is associated with dizziness, vomiting, nausea, light sensitivity, even some vision loss in the eyes.
Wow.
So it's more severe than a tension headache. And a herniated disc typically is not associated with headaches. It'll be just more localized pain in the neck, and sometimes can radiate down into the arms, and there can be numbness or tingling in the arms and pain in the neck.
Okay. So what exactly causes tension headaches? In other words, is there anything that I've done to bring these headaches on myself?
Yeah, so a lot of times patients come in with tension headaches because they have poor posture, muscle imbalances. They could be stressed, not having adequate sleep, and that stress, that tension can cause a lot of tightness in the musculature of the neck and the shoulders.
Oh, okay. So are there any home remedies or treatments that I can do to relieve some of these headaches?
Yeah, sometimes doctors will prescribe medication, or you can take over-the-counter medication as well for pain. Doctors can prescribe muscle relaxers as well. And if it's severe, they can even give trigger point injections to the patient. But a conservative treatment, if you do want to avoid the medication, is physical therapy.
Okay, so what specifically is done in physical therapy?
So when a patient comes into physical therapy, I will evaluate them and see exactly what's causing the tension headaches, whether it's posture, stress, what kind of activities could be bringing on these tension headaches. So after I evaluate them, I will give them a home program to start with in conjunction to what they do in therapy. And physical therapy can consist of modalities such as heat to decrease the tension in the muscles, ultrasound to expedite the healing process as well, electrical stimulation to decrease pain. And also I'll give them exercises and stretches that they can do to relieve the tension in their neck and their shoulders and a lot of the musculature, especially the upper trapezius muscle, which can be very tight. In addition to the stretches, I'll also do a lot of manual techniques, whether it be kinesio tape to restore some muscle balance. There's a technique that's called Graston, which is an instrument-assisted soft tissue mobilization that can also decrease a lot of the tension in the shoulders. And finally, I can do some manual traction or suboccipital release, which will decrease a lot of the tension right at the bottom of the head, the scalp, where a lot of those muscles, the tight muscles, attach.
Okay, so do I need to stop doing any daily activity at home? And if so, how do I do this?
Okay.
And still attending physical therapy.
Right. So I don't really want to stop somebody from doing what they love to do at home, their functional activities. But if something is bringing on the headaches, I would definitely ask them to stop that stressful activity, whether it be overhead lifting or some stressful activities that brought on the tight muscles in the first place. And I will definitely give them postural re-education exercises to do so they can bring about upright posture and decrease some of that tension in their shoulders and their neck.
Okay, so how long do I need to attend physical therapy in order for me to start seeing some results or for the headaches to reside completely?
It depends on the severity of the headaches, how long you've been dealing with the tension headaches, their frequency. So a lot of things go into play. But typically it takes just a few visits to a few weeks to start to abolish a lot of the tension headaches.
Okay, so I've done the physical therapy, my headaches are completely gone. What can I do to ensure that the headaches don't come back?
Okay, so on their last visit with the patient, once I've already gotten the headaches out, they haven't had headaches in a matter of days, weeks, I know that the headaches are gone, I'll give them some home exercises they can do to maintain the stretches, the upper trapezius stretches, their postural exercises, and of course to avoid any of those stressful activities that brought on the headaches in the first place.
Okay, well I want to thank you, Lisa, for telling us all about tension headaches. Very interesting. And I want to thank you guys for watching. Again, my name is Brie O'Brien.